Hey everyone, it's Dr. Hodges. And guess what today is? It is World Lymphedema Awareness Day. We are on day 4 of Obesity Cares Week, and today we are recognizing and want to be part of awareness for patients that are suffering from lymphedema. So, what is lymphedema? What is lymph? And what can we do about all this swelling that you can get? So, your body has little vessels that kind of follow along your blood vessels, and these are your lymph vessels, and you have lymph nodes, and they help to filter extra fluid. They also serve an immune function. And your body actually will filter out at least 2 liters of lymph and fluid a day. And then your body will usually urinate out this excess fluid. So it's really important at drawing fluid out from the tissue space. So what happens when your lymph system is disrupted is you can develop swelling. So there's 2 different forms of lymphedema. There's primary and secondary. Primary lymphedema is really going to be caused from genetic causes, like perhaps when you were born, your lymphatic system, it just didn't develop correctly. So you have abnormal vessels running along, and that is what's going to cause the swelling. The most common cause of lymphedema, though, in the United States is going to be secondary lymphedema, and this is going to be from damage to your lymph system. The most common cause, unfortunately, is going to be secondary to cancer. So, for instance, my ladies, whenever they have breast cancer, for instance, and they have to get a full nodal dissection, like in their armpit, that disrupts all the lymph nodes and the lymphatic system in their arm. And so it's not uncommon for them to have significant swelling in their arms after they've had a complete node dissection. The other is obesity, and that's why we're trying to draw awareness to it. Whenever you have constant pressure on your body, you can cause damage to your lymphatic system, particularly in your lower extremities, and that is how patients can end up developing some fairly significant swelling in their lower body. You can have swelling from damage to the lymphatic system. You can also have damage to the actual venous system as well. And those 2 together can cause lifelong issues with swelling, even once you've lost your weight. So, what are some things that patients can do? Unfortunately, a lot of it is going to be symptomatic treatment. So it's going to be patients might wear compression garments. It's not uncommon for me whenever I have a patient that comes to see me and they're having a lot of swelling in their legs. I recommend that you can go get some compression socks. Now, granted, that's usually kind of crummy, especially if it's in the heat of summer out here in Texas. But man, it sure does make a difference if you wear your compression socks. You can buy these over the counter. I'll have some pinned for you below. My husband actually has a lot of silly socks that he wears, and they're actually all compression socks, and they're really cute designs. You can get damage to your vessels into your lymphatic system, not just from obesity and from issues like surgery, but even from constant pressure, like from standing or doing some certain overuse and movements. And so it's not uncommon for me to also, like if I've been standing and operating for a long time, for me to have a lot of swelling. So I'll wear compression socks. So you can get the Old Faithfuls that are like black or tan, but they also have some really cute ones that are on the market today. And are they tight? Yes, but that's a whole purpose because it helps keep things squeezed in. That way your feet don't look like bread that's rising in a little bucket or in a pan, because that's essentially what will happen. One of the other things that I always try to hammer home to all my bariatric patients, but it's also for anybody that's suffering from lymphedema, is also your diet plays a big role. You really need to watch your sodium intake because that can cause your body to want to just retain fluid. So if you already have poor functioning of the lymphatic system or your venous system, your body's not going to mobilize fluid very well. I think the other thing would be is really try to maintain high protein levels. There are a variety of different proteins that are in the market today. Um, it's inevitable. I will have a patient that tells me, Dr. Hodge, I have tried every protein. I'm like, oh, honey, it is $1 billion industry. I promise you haven't tried every protein that's on the market. There is whey protein, there's pea protein, there's soy protein, there's collagen protein, but you really need to get your protein in. Your goal will be 1 gram of protein per kilogram of body weight. The way to convert this is whatever you weigh, cut that number in half. That's how much protein you need every day. And that's going to give you the best chance at trying to mobilize some of this fluid that might be building up in your body. So keeping your feet elevated at night if you suffer from lymphedema, certainly for ladies that have lymphedema in their arms from previous breast surgery, a lot of times doctors will tell you to kind of keep your arm raised whenever you're sitting. They might keep their arm raised kind of above the heart. That's also, if you have a lot of swelling in your legs at night, keeping your feet kind of propped up, that will also help, kind of help to decrease some of this swelling in your legs. But it's a really tough problem, and we don't have a lot of really good definitive treatments to help people with this kind of really debilitating disease. Your legs feel very heavy. You can have a lot of pain associated with this swelling. So I'm glad that, Pippi. This is Pippi. I'm glad that they're taking the time at Obesity Cares Week to bring light to this problem that millions and millions of people suffer from. So all day today, wear your blue for awareness. Go to obesitycaresweek.org so that you can find out more information about lymphedema and get the word out.